This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the Journal of Infection in Developing Countries, published in 2026. It's titled Predictors of Mortality in Post-Neurosurgical Gram-Negative Bacterial Meningitis, a 5-year retrospective study.
This is a timely topic, Alara. For those of us in the OR and the ICU, Post-Neurosurgical Gram-Negative Bacterial Meningitis, or PNGNBM, is one of those complications that keeps us up at night. While we've made incredible strides in surgical technique, the biological battle in the post-operative period is shifting.
Exactly, Dr. Aris. This study highlights that the incidence of gram-negative bacterial meningitis has actually been increasing. The authors link this directly to the growing number of neurosurgical procedures being performed globally. As we operate more, we are seeing more of these specific healthcare-associated infections.
And it's not just that they are more frequent, they are becoming harder to treat. The paper mentions the impact of global antimicrobial resistance, particularly among gram-negative pathogens. For our residents listening, why is the gram-negative aspect so critical here compared to the more traditional gram-positive surgical site infections?
Well, as the study notes, these pathogens are significant contributors to high morbidity and mortality in healthcare settings. When you combine the inherent virulence of gram-negative bacteria with rising resistance patterns, the window for effective intervention narrows. This study specifically aimed to identify which clinical and laboratory parameters are actually associated with mortality in these patients over a 5-year period.
Right. It's a retrospective look, which is often the best way to catch these trends in a real-world clinical setting. Let's dive into those parameters. When we talk about clinical and laboratory parameters, the study is looking for red flags that help us predict which patients are at the highest risk of a poor outcome.
Precisely. The researchers focused on PNGNBM to see if we can identify these predictors early. In the context of the paper, they emphasize that identifying these factors is crucial because of that high mortality rate we mentioned.
It's interesting because in a neurosurgical context, mortality isn't just about the infection itself. It's about how that infection interacts with the primary pathology, the reason the patient was on the table in the first place. If we have a patient who has undergone a complex craniotomy or a shunt placement and they develop a gram-negative infection, the physiological reserve is already depleted.
And the study points out that these are specifically healthcare-associated infections. This means these aren't the community-acquired cases of meningitis that medical students study in their first year. These are often multi-drug-resistant strains that have adapted to the hospital environment. The 5-year retrospective nature of the study allowed the authors to see how these resistance patterns and mortality predictors evolved.
Looking at the clinical parameters mentioned, though we often think of age or comorbidities, in the setting of PNGNBM, we have to look closely at the laboratory data too. The paper suggests that these lab parameters are vital for tracking the trajectory of the infection.
Right, and for our residents, that means looking beyond just a positive culture. It's about the specific laboratory markers that signal a failing response to treatment. The study's goal was clear. If we can predict mortality based on these initial clinical and lab findings, we can perhaps be more aggressive or targeted in our initial management.
It also serves as a stark reminder of the cost of neurosurgical progress. As the abstract says, the increasing number of procedures leads to an increasing incidence of GNBM. We are, in a sense, victims of our own success. The more we intervene, the more we must master the management of these highly resistant infections.
And that's the takeaway from the study. We can't just focus on the surgery. We have to be experts in the post-neurosurgical infectious landscape. PNGNBM is a formidable opponent, and understanding these predictors of mortality is our best defense.
Well said, Alara. For those interested in the full breakdown of the clinical and laboratory variables, I highly recommend pulling the 2026 paper from the Journal of Infection in Developing Countries. It's a vital read for anyone managing post-op neurosurgical patients.
Definitely. Thanks for joining us today on the Neurosurgery Hub.
We'll see you in the next episode.